Namo tassa bhagavato arahato sama sambuddhassa. Please put our palms together to partake in the offerings to the Buddha. The offering of the 5 items allow us to express our gratitude to the Buddha and serves as a symbol to help us remember the teachings. Please join wholeheartedly and read the verses together. Offering of light. Light symbolizes wisdom. May the light of Dhamma dispel the darkness of ignorance. Offering of incense. Incense symbolizes the fragrance of pure moral conduct. This reminds us to cultivate good conduct. Offering of water. Water symbolizes purity, clarity, and calmness. It reminds us to practice the Buddha's teachings, to cleanse one's mind, which is full of desires, ill will, and delusion, to attain the state of purity. Offering of fruits. Fruits symbolizes the ultimate fruit of enlightenment, which is our goal. They also remind us that all actions will have their effects. Offering of flowers. Flowers symbolize impermanence. The freshness, fragrance, and beauty of flowers are impermanent. This reminds us that we should all live in the present. Remembering thus, we should reduce our craving and attachment. Let us pay respect to the Triple Gem. Arahang sama sambuddho bhagava buddhang bhagavantang abhivademi. Swakato bhagavata dhammo Dhammang namasami. Supatipanno bhagavato sāvaka sangho sanghang namami. We chant these verses for taking the 3 refuge. Buddhang saranang gacchami, Dhammang saranang gacchami, Sanghang saranang gacchami, Dutiyampi Buddhang saranang gacchami, Dutiyampi Dhammang saranang gacchami, Dutiyampi Sanghang saranang gacchami, Tatiyampi Buddhang saranang gacchami, Tatiyampi Dhammang saranang gacchami, Tatiyampi sanghang saranang gacchami. We chant these verses to observe the 5 precepts. Panatipata veramani sikkhapadang samadhiyami. Adinadana veramani sikkhapadang samadhiyami. Kamesu miccacara veramani sikkhapadang samadhiyami. Musawada veramani sikkhapadang samadhiyami. Surameraya majapamadatthana veramani sikkhapadang samadhiyami. Let us recollect the sublime qualities of the Buddha. Iti piso bhagava arahang sama sambuddho vijacarana sampano sugato lokavidu anutaro purisa dhamma sarati Sattha dewa manusanang buddho bhagavati. Let us recollect the sublime qualities of the Dhamma. Swakato bhagavata dhammo Sanditiko akaliko ehipasiko opanaiko pacatang veditabo vinyuhiti. Let us recollect the sublime qualities of the Sangha. Supatipano bhagavato sāvaka sangho Ujupatipano bhagavato sāvaka sangho Nyayapatipano Bhagavato Sāvaka Sangho Samici Patipano Bhagavato Sāvaka Sangho Yadidang Cattari Purisa Yugani Atha Purisa Pugala Esa Bhagavato Sāvaka Sangho Ahuneyo Pahuneyo Dakhineyo Anjali Karaneyo Anutarang punya ketang lokasati. Sadhu, sadhu, sadhu. Okay, good morning, Dharma brothers and sisters. So let's hear some announcements. All right, we have BF Youth for those of you who have kids, or if you know of anyone who is age 17 to 25, we have BF Youth every Saturday at BF West Centers. We have Brother Teo Heng Soon, who will be sharing next week on the 20th, Finding Comfort in Discomfort. So please come and join us. And we also have Junior Youth for those who have kids aged 13 to 16. We do have the service at 3 to 5 p.m. So for those of you who are interested, you can register at the BF office. Right. We have next week, we have Brother Tai Wee, who will be sharing on Sunday service. The topic is transforming suffering with right thoughts. All right. The next one, we also have Indonesian Dharma discussion by Brother Fendi. He will be sharing on the topic, what I learned from Dharma talks on YouTube. All right. It will be next Sunday from 2 to 4 p.m. All right. For those of you who are interested, you can register at the registration link. Yeah, and this is in Bahasa Indonesia. Yeah. All right. The next one, if those of you who have kids also, who age 7 to 9 and 10 to 11, we have Rahula Connects that is starting on 28th of March for the upper primary, right? It will be on Zoom starting at 10:30 every Saturday as well, right? Every Saturday, yeah. And yes, and we have also Indonesian service Dharma talk by Bante Titayano on Sunday, 28th of March from 2 to 6 p.m. as well. From 2 to 4 p.m. All right, it will be live stream on Zoom, on YouTube as well as on Zoom. And for those of you who are interested to join, you can also register at the link because, yeah, for those of you who want to come and attend the talk here. All right. And we also have Yin Yoga. All right, I know ever since the circuit breaker, people are starting to, live a healthy lifestyle. So we have a Yin Yoga program at BF East. It's starting on the 16th of March, which is next Tuesday, right? If those of you are keen, just come directly to BF East, starting at 7:30 p.m. All right. All right, so today we have Dr. Kenneth Tan, who will be sharing with us on the topic is secret. So we will get him to share later on. But before that, we are going to invite all of you to have a very short meditation session. All right.
With your eyes closed, bring your attention first of all to your body sitting here. And please relax your body. How do you relax your body? By being mindful of your body and being kind to it. What do I mean? We can start with your legs. Ask your legs. Legs, how do you feel right now? And keep asking that question until you get an answer. Just imagining your legs to be like separate living beings. When you ask a question of your legs with respect, sometimes my legs tell me that they need to be adjusted, moved. I listen, which means the mindfulness is starting to work. It's not just being aware, it's getting to know. And the kindness means that I change my posture slightly. I often spend a long time with my body when I'm meditating, at the very beginning, to make sure it's all fine. But we've only got a few minutes, so then go to your bottom, your buttocks. I say that because sometimes people's buttocks get sore sitting on a cushion or on a chair. So we want to relax to the max so we're comfortable. It's not just indulgence. This is simple kindness to your own body. And then move up to your back. Just imagining your back to need a big stretch. The reason I do that, I've just been living in forests all my life, and even in Australia, you see even kangaroos do stretching exercises. These are native wild kangaroos. So I do a big stretch of my body at the beginning and just feeling all these chemicals going into my body, just painkillers, immune enhancers, until my back, it feels really great. And then I relax the muscles of my shoulders. Spend some time on my shoulders because they often have a lot of aches on them. I imagine those muscles being pulled apart by two invisible demons, actually four, two on each side. And I let go. Let go of stretching. Let go of stress. Allowing those muscles just to be. And they respond. My awareness of those muscles, you can relax them almost at any time. Oh, that's great. And then I look at my hands. Where are the hands supposed to be? It doesn't really matter. You put your hands in a place which you feel to be comfortable. And ask your hands, like your hands were separate entities from you. Hands, how do you feel? Do you need to be moved? And then you can move back up to your shoulders and neck to make sure that the head is well balanced on top of the neck. Not too far to the left, not too far to the right, not too far forward or too far back. Nicely balanced. And even in your throat, if you have any tickly sensation like I have now, I do have allergies. It's part of what I inherited from my father who had asthma. Just be kind to your throat. Find ways of relaxing it. And then move up to your face. In your face there's many muscles which stretch, scrunch up because of your emotions. And by relaxing the muscles on your face, you can also relax some of the emotions. So I feel the muscles around my eyes, and I loosen them all. And around my mouth too. And once I've just done a quick scan of my body, I next become aware of my body just as one unit, just one whole. The whole purpose is to be aware and kind enough to relax everything. Because I've been doing this for years, I notice that when I deliberately relax my body with mindfulness and kindness, I get this delightful feeling. The delight of having a body which is much more at peace than usual. It's the same delight which people pay a lot of money for, to go to some beach in Bali on a recliner, or to have a body massage, or to go in a hot tub. I do that just automatically, mindful and kind. And I enjoy that delightful feeling. Delight is part of meditation. I just stay there for a few seconds. And then we go deeper inside to our mind. How peaceful are you, or how agitated are you? There's something which I hope you've heard me teach about the peace-ometer, like a thermometer, speedometer. How peaceful are you? Given a number from 1 to 10. 10 is agitated, 1 is very peaceful. What makes that reading go up to more disturbance? What makes that reading go down to more peace? For any one of you who wants to know where this fits in, this is almost third Satipatthana. What causes disturbance to the mind? What stops a disturbance? And you're putting your awareness on peace, peace of mind. You don't think peace, you experience peace. And if those of you who like to watch your breathing, just watch your breath, experiencing it, but don't sacrifice peace. And be kind to this moment, opening the door of your heart to whatever you're experiencing right now. And experiencing it. Don't think about it. Go deeper inside in the thoughts, to the silence which exists in the present moment, just here, relaxing, making no plans, making no judgments. Grant to yourself these moments of peace. You deserve them. How do you feel now? What's it like in your mind? Your emotional world? How much peace can you feel? And how relaxed is your body? And how joyful does it feel? The time is up now. Instead of ringing the gong, I just ask you to slowly open your eyes. And come out from your meditation. And smile. Yeah. Thank you.
All right. I hope you're feeling relaxed and ready to listen to the Dharma talk. All right. So before we invite Dr. Kenneth, I'll just share a short bio of Dr. Kenneth Tan. Dr. Kenneth Tan obtained his medical degree from NUS and completed internal medicine, anesthesiology, and intensive care medicine training in Singapore and in the US. He has been a leading figure in the field of critical care and anesthesiology for the past 25 years. He speaks regularly in training seminars and works with hospitals to continuously evolve critical care. His contributions in the Singapore medical field has resulted in him receiving many accolades, and he is widely recognized as a mentor and pioneer in Singapore. All right, Dr. Kenneth is here. Please join me to warmly welcome Dr. Kenneth Tan.
All right, good morning, everybody. I know this morning I didn't give a topic. Okay, that's actually a reason. I was thinking of whether I should give you all a topic that I would like to talk about, or I just leave it open. Now, usually I think there are many Buddhist talks that we all attend, we all know. There's always a topic, there's always a sutta that you want to cover, you know. And sometimes I think it can be a little bit repetitive and a little bit boring. So what I want to do today is basically sort of in a way free flow, but at the same time I have something in mind. You all just had a session of meditation, right? With Ajahn Bam led the meditation. So I'm going to ask you something here. Okay, so during that session of meditation, what exactly did you do? Maybe somebody would like to volunteer and tell me what were you all doing just now. Anybody? Just tell me what were you going through just now? Relaxing the mind, yeah. And how do you actually relax your mind?
Stop having multiple thoughts going through your head.
Okay. Yeah. So you see, the interesting thing about Buddhism and Buddhist meditation is that We have different forms of meditation taught in Buddhism, very many different forms, okay? Are they all uniquely Buddhist meditation or not? I think you all will probably know. If you have been to other traditions, you've been from other religions, you'll find that actually there are many, many different forms of meditation that people do, all right? And the word meditation is also very loosely used. Even within Buddhism, to be honest, very loosely used, all right? Now, what exactly what exactly do you do, or what is it normally taught today, and what's the important form of meditation that is really, the key thing in Buddhist meditation? Okay, first we will go to one form of meditation that that people talk about for a long time, and it's very common to many other religious systems, and especially in the old Indian traditions. Okay, let's talk about concentration. When you're talking about doing something and concentrating on something, right, you basically focus your mind on one single object, right? One single object, you repeatedly let your mind, in a way, touch that object, okay? Your mind will just engage the object repeatedly. So, for example, if I ask you to look at, say, a candle flame, or maybe an apple even, just an apple, all right? So what happens is if I ask you to concentrate on the apple, of course, each of us will have a different way of doing it. Some of us will look at the color of the apple and concentrate on, say, maybe it's a green apple, so it's green, 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 but it's green and then apple, green, apple, right? That's how it happens, okay? But others will just look at the thing and conceptualize it and say it's apple, 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 apple. Okay? Others will see the word apple and then the word apple. But all the same, your mind is actually doing only one thing. It's trying to actually repeatedly engage the object, the same object, right? And in the same way. So what that does essentially is that if you repeat it enough and continuously, you decrease the degree of distractions that you have in between your thoughts. All right? Because you repeat 10,000 apples, maybe 5 little distractions or 10 little distractions come about, depending on how settled or unsettled you are on that day. All right? So this is known as concentration. We all understand that, right? When you study, it's a lot of concentration, right? But the difference is that as you're studying, there's this little bit of a to and froing. You focus, but the object keeps changing, correct? Because you have to look at the words. Then one moment you see the sentence it becomes a concept that you repeat a few times, and you try to imprint it, all right? After that, maybe you lose concentration for a while, and you think about it, and you drift here and drift there for a while. Then you come back to it again. But if you think about when you're studying, and when you are doing a concentration type of meditation, there are some things in common. When the meditation and the concentration is good, right? The outside world doesn't seem to matter. Time seems to pass very fast, right? I think we have all experienced it before. All of us have been to school, right? You study, something that you like, you go deep into it. Before you know it, wow, 3 hours pass already. You didn't even bother to leave your chair, right? Your butt doesn't hurt. Even you've been sitting in the same position exactly for the 3 hours. Okay, but if you don't like it, wow, every moment is a torture. 3 hours feels like 10 hours, Your mind's all over the place, you don't know what's going on, and the outcome is also very different. So one is that you remember it well, your mind is clear. At the end of 3 hours, you're still not tired. In fact, you feel refreshed, energized. Okay, so there's a very close similarity to the meditation and concentration that we practice. Now, is studying closer to meditation as in concentration, or is it closer to another form of meditation, or, well, loosely I would say meditation in Buddhism? Okay? Nowadays, we always talk about mindfulness. It's become so popular everywhere. Everybody, mindfulness here, mindfulness there, everybody's running courses on mindfulness and all that. Okay? So what's mindfulness at the end of the day? What is it? What does it mean to be mindful? Right? So they say, be mindful of this. Essentially, you can almost replace the word be aware of this. Correct? It's as simple as that. So awareness. Now, when you're doing your concentration practice, You are actually being aware, but you're being aware of that object. All right? So if it's an apple, it is the apple, apple, apple. So you're aware constantly of the apple. So awareness is nothing more than actually engaging the object repeatedly. Right? Now, the difference between what we talk about as mindfulness today in our day-to-day life, or what people are teaching today, is nothing more than awareness of a moving target. Okay, moving target. In Buddhism, when we talk about awareness or mindfulness, they say knowing the mind as it is, knowing an angry mind is an angry mind, a lustful mind is a lustful mind, right? So it's basically recognizing it as it changes and as it moves. Okay, so is this similar to engaging the apple? Yes, it's actually similar, you know. The only difference is that you do not pin your mind on a single object. You let it flow, all right? You let it flow and you follow that flow. Follow, I use the word very loosely here, I'll explain why. You follow that flow in the sense that as the process arises, in other words, as the thought arises, the feeling arises, or whatever object comes through either the sense doors or the mind, right? You place your awareness on it, all right? So it is basically like you are the CCTV, right? And there's light in the room. So awareness is the light in the room. So the CCTV is always on, which is your mind, it's always on, all right? So you have light in the room. So the light in the room is your awareness. It allows you to see whatever goes in the room, all right? So whatever people walk in, walk out, you know, there's this sound appearing from heaven knows where, from outside the room or whatever. It doesn't matter. The CCTV can record the sound, can see the images. It just does that. The CCTV doesn't follow the sound. The CCTV doesn't follow the object across the room, unless you have a tracking TV, right? It doesn't follow. It just, okay, the thing here, the image is just there, all right? But it notices, or it takes note, right? In its sensor, it takes note that there is such an event, whether it's mental, audio, visual, or whatever, right? So your mind is like that. It just takes note. Now, how is this different from your day-to-day functioning? Right? You may say that I'm normally aware, I know what's going on. Yeah, you know, yes. But if you actually sit down for a short while and you try to meditate, whether it's like, you know, sit down and concentrate on something, a single object, or you allow your mind to watch a flow of things that come and go, you will notice that there are lapses, right? There are lapses where something attracts your attention and then you create a story and actually you lose track of that. You are now following the story and not watching. Okay, you're not watching anymore, all right? So in our normal day-to-day life, this happens very frequently. And when this happens, you will actually miss what is actually going on, right? Now, all of us know what it means to daydream, right? We daydream, right? You have this, you think something triggers it, and then you fantasize about something, and then you go into this whole complex story. But the interesting thing is that in this complex story, usually things are not very clear, right? You have a story, but the details of the story are never clear because your mind has become a little bit less focused, even though you notice the components of the story, but there are so many emotional components and sensations and a lot of things there. A lot of it has gelled into one big lump, you know, right? So it's no longer that clear, right? And when you're daydreaming, you may think that it's restful, but I'm quite sure you all know, right? When your mind is drifting all over the place, and in one good example, when your mind is going all over the place is when you're very anxious, right? By right, anxiety should make you very focused on your mind because it is a heightened state of arousal that is part of your fight and flight response, right? But the reality is, if you've been anxious about something or worried about something, you realize that your mind is actually not sharp. Very often you are actually being bothered more by what in Buddhism we talk about as the hindrances, all right? So those of you who are familiar in Buddhism, you know about hindrances, but essentially putting it in a very simple way, they are basically distracting emotions, all right? So they engulf you and your mind becomes engulfed in that emotion and you no longer become as clear about the events that are happening. The whole thing becomes a blur, all right? And the emotions take over as to the forefront of things, all right? And because of that, you never get a chance to realize what triggers the problem, why your mind, how A leads to B, B leads to C, C leads to D, and maybe E and F and G may affect it. You don't see it at all because the whole thing is all lumped into one, right? And the hindrances are like, putting a veil or putting, like blurring your lens out, you spray some water and then it blurs it out a little bit. So the focus is no longer there. Of course, today when you talk about practicing mindfulness, as I said, it's taught so many places, even in medical circles, everybody wants to talk about it. A lot of business circles and everybody talks about it, right? So I'm very curious, so I always ask my friends, so what have you been told? What have you been told to do, right, when you actually are taught to practice mindfulness? Actually, you are already mindful most times anyway, correct? It's only that you are also unmindful at other times. It's not that that mindfulness doesn't exist in normal day. It does. It has to. When you learn something and you focus on the thing well, you are being mindful of it, all right? So just before I forget to say anything, is that comparing a mindfulness, concentration in mindfulness versus concentration on a single object, which we call one-pointed concentration, both require some degree of concentration, all right? They are not free-flowing, dissociated thinking. There's some degree of focus, all right? So it is not entirely true to say that these two things are different. They are same, but yet not the same. Okay, right? So you must understand that. So a person who can practice good concentration has a good chance of being very mindful because you have very good control of focusing. So you can focus on every event that occurs in your mind, that arises in your mind, right? Similarly, a person who is very, very mindful will find it not so difficult to have concentration, okay? But of course, one can be stronger than the other. So one is a moving object, one is a more or less constant object, okay? Now, so in Buddhist meditation, say for example, you sit down and you are asked to watch your breath. So what are you doing? The breath can do two things, okay? One is that if you were actually to notice, for example, the movement of the breath in and out, whether it's your belly moving or the air moving in and out, the temperature, or you may notice it at just the contact point at the tip of your nose, for example, all right? All these are described in Buddhism, right? You see, you can see that the breathing meditation has two different ways of doing the same thing. So if you notice only at one point at a contact, that's almost like a one-pointed concentration. If you notice the process of movement, right, it is like a mindfulness practice. But both also trains concentration, right? Now, you may also encounter, for example, say Tibetan Buddhism, very colorful, And if anybody has been through a meditation session at the Tibetan Buddhist centers and all that, you know, right? There's a lot of visualization, okay? Or for that matter, you go to a Mahayana Buddhist temple, a lot of chanting and some rituals and all that, right? Also a moving target. And when you're in it and you're immersed in it, you are actually being mindful, all right? So the only difference is that some people find it difficult to anchor their mind on a single object, all right? So a meditation that is guided with multiple components is like being led on a leash, right? So it helps them. And eventually, if they are good at it, they can just sit down and be one-pointed. That's not a problem, okay? So it's just for different personalities, different inclinations, right? Other people, if you ask them to just sit and focus on one thing and they are just used to watching things as they flow, they will find that it's very boring. Then after a while, they say, forget it. I just go back to what I'm doing. So is one inferior to the other? Strictly speaking, not. Okay, they're not really inferior. They're just two sides of the same coin, done with different objects and slightly different variations for different purposes. And that is also why in the Buddhist teachings, the Eightfold Path, there's also right concentration, right mindfulness, right? They are actually quite similar, again same, but not the same, okay, right? They actually enhance each other. So the division between samatha meditation and, say like vipassana meditation, you must have, one says must have a lot of jhanas and all that. So if you're a very deep jhana, can you do awareness? Well, you are actually aware of a single object, right? But if you do practice, say, for example, satipatthana, then you're just multiple objects. Okay, so not too different. The factors actually not too different. One goes deeper and actually makes your mind really, really razor sharp and pinpoint. The other one allows it to move around, but at every point it's actually sharp. Okay, at every point it has to be sharp. And then that's where you are considered mindful. If you notice the changes and it moves along and it's not sharp, then you're not being mindful. Okay, so these two things are actually quite similar. All right. Each has its own benefit, and also your inclination as to which side will actually cause you to have a better outcome in a sense. Now, what I would like to address here is another issue about mindfulness is about when people are taught sometimes to do this mindfulness practice, they are told that, you have to watch your thoughts and your emotions as they come and then go and then decide whether they are good, they are bad, or whatever, Yeah? As I said, yes, you recognize them as what they are, but be careful. Recognizing them for what they are is not the same as putting a valued judgment on them. It's a different thing. Because a value judgment on them is actually an emotional thing that you have placed on what you notice. Okay? That is not a good thing. Now, I tell you why. Because the moment you put a value judgment on it, other emotions will come. Right? Like, for example, you watch and you see your mind and you see this unpleasant thought that has arisen, or this, what you have judged to be an unwholesome thought that has arisen, and you have labeled it as such, and then you start to feel guilty, you start to feel this and feel that. Or you feel a pleasant thought and then you get attached to it, and then the other things like feelings of pleasure, yearning, clinging, all comes up. All right? So that's not a very good idea. All right? So that's the thing that you have to be careful about. Knowing them for what they are is fine, but it has to be a detached, dispassionate knowing for what they are. It cannot be an emotional, personalized knowing them for what they are. It has to be, in a way, a depersonalized. In other words, you have to be a little bit removed from the thought process. In other words, you don't want to be identifying with the thought process. You just let the thought process be a thought process. All right? So in other words, a thought of, say, for example, anger arises. So you just notice it as, you want to name it as anger, you can. If you don't want to name it as anger, you should actually, ideally, just give it a neutral label in a way, right? Just say, okay, a thought. Deep inside, you get this little inkling that it is anger, but it doesn't matter. Ignore it. You just say a thought, all right? Okay, just notice a thought. You just look at it and try to not identify. Okay, this is a very thin line. Because once you start identifying in the thought, right, and the emotions, what you have done is actually build the association of that being you. And then it generates a reaction inside, right? And it triggers a whole set of things that will actually destabilize your ability to watch. Okay? We are all like that. You can't help it, right? The moment, for example, you have thought of anxiety, right? You feel this sudden, like palpitation or something coming, and then if you just notice it as what it is, palpitations, yeah, maybe anxiety is coming, but it's just palpitations. So you just feel heartbeat fast, okay. That sensation, you want to label it, can. You don't want to label it, also can. Right? Doesn't matter. Let it come, let it go. Let it come, let it go. Just notice as it comes and as it goes. Don't care what it is. Don't identify with it. Don't put a emotionally charged label on it. It may not be possible not to put a label, but not an emotionally charged label. Just let it be. Okay? Now, how can this be used to sometimes solve your problems? All right? Because it seems like you're not doing anything, right? You're just a spectator, right? Now, there are times after your so-called official sitting session, okay, you can always review it after it's done. Like, for example, if you're sitting for a while and you're doing this intense session where you are watching it come and go, During the session, do what I mentioned. After the session, you can always review and see what the associations are. Like for example, you can see that after the session, you say, I recall, because your mind has been sharp, so you should be able to recall very clearly. A led to B, B led to C, C led to D. So if it is something that triggered something unpleasant, you notice the cause-effect relationships already. But this should only be done after you're done, right? And then not while you are doing. Because if you do that while you are actually trying to be mindful, you are no longer mindful, okay? Right? So because that process that comes after is a thinking process, all right? Is there awareness in thinking? Yes, of course there is, but it's not as keen because there's actually another process going, right? Now, this is important because if you are having a problem that you need to deal with, whether it is an anger problem, an anxiety problem, whatever, identifying the trigger is very useful, right? Sometimes it's as simple as this. I see this person, I just don't like his face, okay? So the moment you sight that person, you feel this discomfort coming up. But you don't know why, Sometimes a lot of us just miss it, you see, right? It just happens, and you see, just this sudden discomfort comes, but you don't know what it is. But if you had been just fully aware and in the moment when it occurred, and you review it after that, you will see the association. Maybe because this image of the person arises, it triggers a memory of some sort, maybe, or association with something that looks like, sounds like, smells like, whatever, and then this, whatever this is, triggered an unpleasant reaction before, and therefore you feel that reaction, okay? A lot of times it is not known to us. It's so deep inside, it's not known to us. But if you had been very aware of it, right, during the period when it occurs, then you will find that you are going to be able to identify it and deal with it. Now, all difficult emotions and sensations and all that are just what they are, and they only arise, right, one by one, okay? Much as we always think that we have a lot of emotions and all that come at the same time, or we think that we multitask, okay? But strictly speaking, we never really multitask. There can be concurrent processes in your brain. There's no doubt about that. Many concurrent processes. But you can only focus on one at a time, right? There's no way you're going to be able to focus on everything at the same time, all right? Like, for example, I look in this room here, right? Much as I see everybody here, right? But my focus actually shifts moment to moment, okay? Everybody in this room is projected on my retina. All right? My retina actually registers the image, but the retina only notices what I put attention on. Right? So if I do not look at you, right, you can be in the image, but I don't see you. Right? We all know that, right? You can walk in the room and you miss what's going on in the other corner of the room. It's not that your eyes didn't register; it registered because the light did hit the object, did go to your eye, but how is it that you didn't see it? Okay, so sometimes we always like to joke about it, right? You can look but don't see, which is true, right? So it basically tells you that the mind is only able to focus on one thing at one time. So multitasking is an illusion. It's because of the speed at which your mind works. That's why you look like you can multitask, but actually you can't. Okay? Now, that's important to understand and recognize for a simple reason, that because your mind can only do one thing at one time, it is where it actually is a benefit, not a disadvantage, all right? Because, for example, you have an unpleasant or unwholesome emotion or whatever has arisen, right? The moment you notice it, it has taken place of the emotion or that thought, right? So that one straight away loses its power. You've actually interrupted it in its track, okay? So normally what happens is that this thing comes up, and then it triggers another thought, another thought, another thought, and you notice it 5 steps down the line. It's already gone quite far, and sometimes it's gone to the point of no return where it's created a huge emotional sort of outburst already, right? But if you notice it very early, you interrupt it by noticing, it loses steam, all right? It's basically catching the robber in a room. Once you catch it, the fella can't go and ransack a room anymore, all right? So that's basically how your mind works. And this is actually a very powerful thing, okay? And this is how actually your mindfulness actually helps in developing a lot of self-understanding, right? And also the ability to actually control your unwholesome processes, whatever they are, right? Without suppression, okay? Normally we always say, okay, you have this problem, you just suppress, you behave properly, you suppress, right? A lot of us do this. I mean, we're always taught that way, suppress. But all of us know, right? You suppress long enough, it will bottle up, it will blow someday. Because the problem is never solved. You have never weakened the thing. You just pressurize and just stuff it further down, okay? So this is where the approach using mindfulness is different. It's very different. You do not stuff it down, you do not pressure it down, you face it head on, you basically catch it in its tracks, and then the fellow will be a little bit shy, the fellow will go and hide and run away. After a while, the fellow will say, okay, enough, I'm always caught, I'm not going to come again, okay? Yeah? You don't have to tell him, don't come. You tell him, it's okay. You come lah, it's okay, I caught you, that's it. Move on. Caught you, move on. All right? So this is very nice because if you don't judge it, you don't have all the emotional overlay, whack yourself over it and things like that. The whole process is positive. It doesn't generate negative emotions, doesn't generate any negativity. You do not become depressed just because you had a lot of unwholesome thoughts. You don't become depressed. Because some people, when they go to religious talks or like Buddhist talks, they say, wow, Buddhists are all so depressive, they say this wholesome, that unwholesome, I'm so bad, I got full of defilements, blah, 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 right? The teachings are meant just to highlight the problem. The teachings are not there to make you feel guilty or whatever, because this is the human condition. You are not going to be able to run away from it, so deal with it, all right? And are we going to deal with it by hammering ourselves? No, don't need to. There's no necessity at all to hammer yourself. Because hammering it does not solve the problem. Recognizing it is the beginning of solving the problem. Like the Four Noble Truths, you recognize the problem, then you find the solution, right? So this is how, as Buddhists, we approach it. We all know, all of us have all sorts of thoughts that range from the very wholesome, good, things that we can show to the world, and to the things that we don't want anybody to know, all right? It doesn't matter. If you ever think that somebody else doesn't have those thoughts, you're kidding yourself. All of us have the similar types of thought patterns, all right? It's only whether it comes up, whether we talk about it, we tell people about it. That's all there is to it. There's nothing else, all right? So let's be realistic and kind to ourselves and accept the fact that this is how the mind works, all right? And this mind that we have, dependent on the body, has evolved over, thousands, millions of years, right? When we were maybe simpler organisms until today. For various reasons why it is like that, right? It's for survival of yourself, it's survival of the species, for whatever the reasons are. That's how it's evolved. Because human beings, we have made it very complex because we think, right? If you are a simple amoeba, you poke the fella here, the fella just withdraw and move away. Right? I don't think the amoeba thinks too much about it, okay? But that's the most basic reflex. But are you saying that you don't have the reflex? You also have the reflex. It's noxious, you run away lah, right? It's not pleasant, you run away, right? It's only that we now rationalize so many things over it, all right? Because our neural networks have become so complex, okay? So we recognize that these things are natural, nothing to hammer yourself about, just deal with it, right? Just deal with it. And because your mind only can hold one object in focus at one time, you just have to catch the mischief maker. Every time you notice the mischief maker will say, okay, I've been caught. I will try to not come. Okay? So after a period of time, you find that it's easier and easier to deal with the problem. Okay? And that is actually where mindfulness can become very useful to all of us in a practical way. All right? So if anybody will tell you that you want to practice mindfulness and while you're doing the practice, you must notice it and then you must say that this is bad and this and that, please don't do that. All right? When you're noticing it, you just know it as it is. No labels, no emotional overtones, nothing. All right? It's bare awareness, just aware. All right? Unless you can afford to, if you're comfortable enough to put a thing that is there. For example, if I say, knowing angry mind is angry, it doesn't mean that you know that angry mind is angry and unwholesome. You just know angry mind is angry, that's it. Actually, it's very interesting. Even if you look at Satipatthana Sutta, right? A lustful mind is lustful. But it did not say alasuma is lustful and unwholesome. It doesn't say it like that, no? Just say knowing it as it is. So it's like that, it's like that now. All right? So don't add too many levels of value to it, or, to make it complicated. All right? Because the strength in the process is its objectivity. And the objectivity that is devoid of all these value systems and all this. All right? I mean, we all know what it means, right? You don't have to add the thing when it's there to interfere with your process. Okay? So now, another thing is, of course, mindfulness in a sitting session, in a meditation session, or whatever. Again, this is theoretical, right? By right, you should be mindful most of the time, correct? So do not think that practice of mindfulness is all about just a sitting session, 1 hour, half an hour, whatever, That is the wrong way to look at it, because you should try to extend this mindfulness out of that session. But of course, we all know we are not used to it, we're not so trained in it. So the sitting session is supposed to actually reinforce and consolidate the practice, so that you become a little bit it's like a workshop. Every day you sit down is a workshop for yourself to get better at it, so that you can extend it beyond the period of your sitting. Because there are more hours in the day that you don't sit versus the hours you sit, right? So why are you restricting yourself? Can you practice mindfulness at work? Of course you can. That's how I actually sometimes teach my juniors last time when you do a procedure, all right? Say, for example, you're doing a procedure for the very first time. For most of them, what actually gets to them is that there's a lot of fear, uncertainty. They think of 1,000 complications. They're scared they hurt the patient. They're scared they'll be sued. They're scared this, scared that, all sorts of things. So they are not present with the procedure. So they never learn. All right? You can take them through 10 procedures. They still make the same mistake because they were not present. They were full of worries and distractions. Whereas if you tell them that no, you just be present, notice every single step. If you're moving your right hand, you're moving your right hand, moving your left hand, you poke the needle in, you feel that this is the resistance. You just need to do 1 or 2. You will know exactly what it is. Right? You remove all the what I call the hindrances when you're doing it. You will learn very fast. All right? How unpleasant the task is, how difficult the task is, if you're fully present, you will know exactly what it is. All right? So this can be applied into our day-to-day life while working. You don't have to label it as meditation, you don't have to label it as mindfulness practice. It's just a practical way of doing things. Especially for any one of us here who do things with our hands, where you have to do, where you have to have multiple procedures or a complex sequence of things, right? The best is to be present, very present when you're learning it. You'll find that you don't have to do 20, 30, 40 before you become good at it. You just need to do 1 or 2 fully present because you know every step. Every step is etched in your memory very clearly. Yeah? And I'm sure you all have worked with people who, do 10 times still like that. That's the reason, because they were not present. They were thinking about every other thing except the thing they are doing. Okay? So mindfulness is also something that can be extended to work, day-to-day work. Right? And not something very esoteric, sit down and meditate, go to the cave, go to the mountain, whatever nonsense, Yeah? Or is it now a big money-making business now, roaring business everywhere. Everybody wants to teach mindfulness, right? No, nothing very fantastic, nothing very, it's actually very simple. All right? For those of you here who actually may have gone to learn yoga or whatever, you know. Actually, yoga is mindfulness of the body. Right? You're told to be fully aware when you're doing a posture, right? You're aware of how your feet lands on the floor, where the pressure is, right? Where the tension is, you adjust here, you hold there, things like that, right? But of course, when you're initially learning it, you are so obsessed with the form that you do not pay attention to the details. In other words, the awareness is not there, but you're more worried, about performing or how you look to the next person next to you, right? So you can see this technique is not new. It has been around. It's been around in various traditions, although Buddhism has brought it to the forefront. Right? And mindfulness can be practiced on mindfulness of the body, or the feelings, the emotions, the thoughts, whatever, everything and anything also can. All right? So it's not a sit-down affair. It's not only when you are doing a retreat. No. Actually, mindfulness can be actually very, very easily practiced at all times. So is there a reason to do meditation beyond mindfulness? Actually, there is. Because as I mentioned to you just now, mindfulness is actually concentration on different objects as they come along, right? Point-to-point concentration. But to enhance that, actually, periods of one-pointed concentration would be also helpful. They actually both enhance each other, all right? So a good balance of these two practices are good, right? And that is why it's also good to actually have a period of time where you just sit down and, and you do maybe focus on your breath or an object, right? A single object, just for short periods, okay? Sometimes for some of us who do certain kind of work, actually the opportunity presents at work when you actually have to do something that is very focused. Then your mind is very focused only on that object, holding it still just there, right? And we all know, right, how hard to hold something still for a short while. It's so difficult, you see, because our mind keeps moving. Your mind moved, your hands will move, okay? Right? So both of these things are complementary, so they should not be separated out. The separation, was also called samatha meditation and all these things. It's actually a technical separation. There's no real separation. Yeah. In the early days of Buddhism, I don't think it was so clear cut. It's only later that they actually came up with all these classifications, a whole long list, a whole long list. It's basically very academic, yeah. Yeah. But I suppose it's still useful. It's still useful. Yeah, but I think on the ground, as we practice and all that, I don't think we should be too hung up on that. We should just relax, just be aware as and when we can, and of course have short periods of more intensive training by just carving out short periods of time for you to intensely sit and be with your mind. Yeah. Now, do you have to do long periods? No. In fact, I would rather have short but good sessions, maybe repeat it a few times rather than long, but 1 hour, 15 minutes good, 45 minutes wasted time because your mind's everywhere. Yeah? So keep your mind fresh when you're doing, so that's where you can actually get the best result because your mind is sharp, right? You're not distracted. Naturally, as you do it, the periods can lengthen with no problem. But don't be in a hurry. It's like training at the gym, right? You cannot straight away carry 10 kilos, 100 kilos or whatever, right? 3 weeks, 5 kilos. Another 3 weeks, maybe 7.5 kilos. The mind's the same. You exercise, right? Give it some time, be patient, right? As Buddhists, we know this is not your only lifetime, so it doesn't matter. Didn't finish, next lifetime, carry on, right? You happen to do it faster, good for you. If not, just carry on. Yeah? And just make sure that you maintain your connection with the Dharma. That's it. End of story, right? Okay, thank you.
Thank you so much, Dr. Kenneth, for the very insightful and inspiring sharing. Can I invite everyone, those who have any questions, to ask Dr. Kenneth?
Yeah, just fire away.
Anyone?
Practical questions, definitely, please.
Maybe I'll just start with my questions. Dr. Kenneth, like as a doctor yourself, right? How does mindfulness practice or even Dharma practice helps you in your job as a doctor, especially you're taking care of the critical patients and all that? Yeah, how does that help you?
Okay, first of all, what I mentioned to you just now, when learning something new or doing a procedure and all that I don't do frequently, the mindfulness is important because it allows me to be very present and therefore I tend to be very careful with things. In other words, your chances of error is actually much less because you're very with what you're doing, right? Especially in emergency situations where there are people screaming around, dropping things, Those who work in hospitals, they all know, right? We will be like, nurses will, I need this, I get that, everybody is all in a frenzy, All right? So being calm in a frenzy is very important. Being focused on what you're doing in a frenzy is very important, all right? Like, for example, for us, my job, I do anesthesia, I do intensive care. Now, in anesthesia itself, for example, when we put a person down to sleep, Okay, that sounds very easy, but of course there are a lot of things that goes into it. Yeah, but when we actually, after we put them to sleep, we sometimes paralyze them and put a tube down for them to breathe, right? Now, everybody is made differently. There are times when we paralyze the patient and then, oops, I cannot put that tube down because I cannot see where the hole is, where the larynx is, okay? So that is one of the worst things that can happen to most anesthetists, all right? Of course, we are taught in many drills and all that what to do and all the algorithms and all that, right? But you must have a ability to keep yourself focused at the task on hand so that you can make a decision whether you choose option A, B, C, or D. All right? Yes, algorithms are there, but nevertheless, every patient is different, right? Sometimes you choose B, not A, even though the algorithm says A first, because what you see is not textbook. All right? It's different. And in a situation where your patient is paralyzed, but you're not able to put the tube in, and sometimes you realize that you cannot even ventilate the patient. The patient's going blue on you. All right? Here you go, the alarm, bing, bing, bong, bong, bing, bing, bong, bong, alarm, trying to tell you the patient's going to crash on you, right? And this patient walk off the street, right? It's no easy thing, right? Because you're also getting anxious, because you may lose a patient just from what you have done. That's terrible, right? Nobody wants to do that, okay? So I used to joke about it, okay? So as Buddhists, I would say, the first alarm to silence is not the monitor alarm. The first alarm to silence is press here, okay? You silence this one first. And then you'll be fully present, you will be able to solve the problem, okay? And my juniors used to joke also. They said that, I get worried when you become very quiet. Because when something bad like that happens, some people will be very, I will usually move aside. Just let me take over, and then I'll be very quiet. I just say one or two words, that's it. They know that it's a bad situation, all right? So that kind of thing is a very Buddhist approach to things, all right? Because we know that the alarm that goes off is here, all right? I mean, yeah, there is a situation, but it doesn't help if this alarm is causing more alarm, right? So we silence this alarm. Because I need to silence it because the alarm on the monitor is very loud. It's meant to really, essentially it's calling for help and attention, right? That's the whole idea, okay? But that it also affects your internal stability because it's loud and goes ding, 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 and then the sound ding, 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 going down, It's really, I can tell you, it's actually terrible, right? And sometimes it's so fast, and then first of all, you hear the oxygen level going down. Next thing you know, the heart rate is going down. That means your patient's almost going to crash on you already, all right? So silence this alarm so that I can focus fully, right? Because you see, at that point in time, for me to have the alarm internally going off does not help, all right? Because it's going to happen whatever I do. It's more important that I am focused with the situation and get my job done, right? And if the patient crashes, what I need to do immediately to reverse the problem. That's all. So being a Buddhist, the attitude is a little different, all right? So no thing. And of course, also because of the practice of awareness there, you also are aware of a lot of small things in the environment that are going on, all right? And you pick the things that are important to do. There are many things that are there that asking for your attention, but need not be done when the situation is like that. So this helps a lot, okay? In the emergency. Now, in a slightly different sort of situation, like for example, when you're dealing with a patient, say maybe a patient with cancer or whatever in the ICU, okay? Many medical, ethical, sort of issues may come up in terms of when to give up, when to, whether to give this drug or just say, okay, it's enough, advise the family to let go and things like that, all right? Now, this has got a lot to do with what we believe and also how comfortable we are with uncertainty, suffering, and death, all right? So as a Buddhist, I think this is extremely important that we are aware of our own inclinations and how it affects our decision and how it affects the way that we recommend things to people, all right? And this is where I find Buddhism is very good, because we recognize, like for example, different families and patients are different. We do recognize, we are able to also sense their little emotional needs, and that they sometimes don't verbalize, or they don't even know that they're having it, right? They behave in a particular way. On the surface, it looks very irrational, but there may be other reasons behind it, right? But because you are able to reflect on the mental processes, right, you can understand that this is coming from maybe this or that, something else. And therefore, you can tailor the way you talk to them, or you tailor what they require in terms of treatment according to what they actually require from you, right? We know as Buddhists that everybody will have to die. We understand that. Yes, it is my thought as Buddhists that sometimes when the suffering and the treatment is futile, we should let go. But it's not for me to impose that on anybody. They have to decide, right? So out of our Buddhist understanding of death and our own acceptance of death, our default can be that when it's futile, we should let go. But this has to translate into how we deal with the patients and also advise them accordingly, both with that as the background and also at the same time not forcing the decision on them. So in other words, if it's truly futile, how to help them work through that process. Like, for example, that people are, like sometimes they want to carry on, they're futile. They know also it's futile. A lot of times people know it's futile, right? But they carry on because of clinging. But sometimes the clinging attachment is not clear because they don't know what they are feeling. Like, for example, they say, okay, I want to save my parent, right? I do not want them to die because I think I must do my best. But they don't realize that they have already done their best, right? They provided everything that could have been done, and this is really, really end of life, right? And they don't realize that the so-called wanting to do their best at this point in time, at the end, is just the attachment to the parent. It's no longer out of compassion to parent. You know what I'm saying? It's a thin line, but it appears the same, right? They themselves don't know, That's the interesting part of it. They themselves don't know. So sometimes after you talk to them for a while, explain to them the futility of the event and all that, and sometimes you just have to broach the subject a bit carefully, but I sometimes do ask them. I say, sometimes, yes, we would like to do everything, and you all have done everything. We assure them that we have given the best, whatever we can do. And as family, you have actually really left no stone unturned, right? But at this point in time, being futile, we do not want to impose more suffering on the patient unnecessarily, as we do not think that it's going to produce any decent outcome. So sometimes if you feel that you cannot let go or whatever, you have to really examine. I actually tell them that you have to examine whether this is for yourself or for your parent. And it is okay to let go out of love, right? That doesn't mean that you have neglected or anything like that. It's also just as important that, letting go and so that they do not suffer anymore is also a kind act and out of love for your parent. So this is how the Buddhist approach is important, all right? Because first of all, we accept the fact that death is inevitable, all right? So we do not think that, we have to preserve life at all costs, right? Because preserving life at all costs is an illusion. We all know that, right? We can do whatever it is you want to do. When the conditions do not support life, it will not support life, whatever you want to do. And I also have to deal with people who believe in miracles. Yeah, quite common, even Buddhists also like that, right? Or maybe got miracle, right? So I will sometimes, I will find opportunity to tell them, sometimes a bit bluntly, sometimes not so bluntly, right? Yeah, so if I tell them bluntly, I will just tell them, well, these things do not happen. We see death all the time. Everybody believes in it, but it never happens, okay? Yeah? Of course, as Buddhists, we always know deep inside, well, if there are miracles, first of all, why must it happen to you? What's so special about you, right? We have to remind ourselves that, right? Why must be you? No need to be you, right? Secondly, the world will be overpopulated, if everybody survives from miracles, right? I think even all the planets, solar system is not enough, okay? So anyway, that's how I feel that Buddhism has helped me deal with this type of situations, emergencies, and also this type of sort of like end of life issues and all that. And because you see, in the practice of mindfulness and all that, you also recognize how these emotions and thoughts actually work in yourself. In other words, you are able to reflect it inwards, and therefore you understand what is going on there, and then you can tailor. You just have small little things, and then you tailor it to them. No two patients are the same. Everybody's different. Yeah? But we have to keep in mind what our intentions are. We have to be very, very clear. Because I can do something to the family and tell them out of fear of litigation. Right? Because I don't want them to blame me. Okay? So as a Buddhist, we have to be very clear inside of our intentions and everything. That's why the self-awareness is very important. So I know when I say something to them, it's not because I'm afraid that they think something about me. Right? I say something is because I know that this is what has to be done and this is in their best interest to do it. Even if you don't like me, so be it. It doesn't matter. All right? We cannot please people all the time. There's no way you can do that. And that will not be true to yourself anyway. Yeah. Anything else?
Dr. Kenneth, 20 years ago I met you in SBF. So actually you do some very interesting talk about, death and people dying. And then the most interesting part is that the last part of your message, you say that, we are all here and then we're going to hear again. What makes you so sure that we are going to be here again?
I'm talking statistically.
But the other thing is that I think about, people that is dying and then they start to see delusion or illusion, they start to see all kind of figures. Have you seen those or
actually, we do see we do see all sorts but of course, in the modern context, when the patient's in the hospital and all that, especially now with modern medicine, it becomes a very complicated issue. A lot of the things that we see may be due to drugs, maybe due to the illness, right? So it can be really hallucination, right? Which is probably very common nowadays because we do give them a fair bit of drugs that will affect their brain, all right? In an effort to decrease their suffering. It's very controversial from a Buddhist standpoint, right? But there are Buddhists who we deal with, very, very, how can I say, practicing Buddhists, all right, who have requested that we do not sedate them, regardless, all right? And most of them actually, to the very bitter end, die clear-headed, okay? Now, from a medical standpoint, of course, I say there are many diseases that actually can cause a patient to hallucinate, okay, like infection, strokes, liver failure, kidney failure. So all these things affect the brain, right? And the brain is a basis of some of these, hallucinations. It is the basis, right? And also in Buddhism, we know it's always interaction between mind and matter, right? And, can you pinpoint where? No, we can't pinpoint where. But all I know is that for the people who are very into Buddhist practices and meditation and all that, we were usually not a problem, when they actually ask not to be sedated or minimum sedation and all that, they are very clear-headed to the very bitter end, honestly. Yeah, I've seen, because I've had requests even from my own friend who passed away. This year should be maybe 7, 8 years or maybe 10 years even, I don't know. It's quite long already. So he asked not to be sedated. So I told him point blank, I said that, hey, I can't let you suffer, right? If it's really so painful and so bad, I have to give you something, all right? He said, okay, you just minimum, whatever minimum you think, you just try, right? Because for us it's very important, right? Because it determines, to some extent, it determines your next rebirth as Buddhists, right? How your mind states are at the point of death. See, so, and especially for those who want to practice certain meditative techniques where they have to practice around the period of death. You see, so in those cases, we will just give them other kinds of painkillers as much as we can, and we avoid certain hallucinogenic drugs that will cause them to cause hallucinations. Yeah, but in the general practice of medicine, I mean, in general, all doctors, I'm not talking about us, because we have our own, of course, our own biases here. We do give a lot of like benzodiazepines, like Valium, like things like that, similar to Valium, not exactly Valium. For pain, sometimes they use this thing called ketamine, which is used as a hallucinogen and party drug nowadays. Yeah, you see, so do the patients hallucinate? Definitely, yeah. But it's interesting also that people who are a little bit more sharp-minded from maybe previous training or whatever, they do recognize the hallucinations as hallucinations. That's very interesting, actually. Some of them do. Some of them tell me, hey, I can see this. I think must be the drug. Hey, last night I was talking nonsense. No, I don't know why, but I was talking nonsense. They know, you know. So it's actually quite interesting, right? But then, of course, there's also a lot of people who are at the point where they really don't know what's going on. Yeah, and they just, they see their relatives, they see their whatever who has passed away, you know. Yeah, but I don't want to really go and dwell on those things that we are not sure about, you know, because these things we cannot be very sure, yeah, whether there's any basis for it or not. Because a lot of these things also are past memories, you know, very long, deep memories that come up, right? And of course, we do know that as you are about to die, your senses shut down slowly, but one of the things that shut down very late is actually probably hearing. Yeah, hearing is one of the last to go, usually. Vision goes very fast, but hearing goes very late. Yeah. So, of course, as Buddhists, if the family is Buddhist, I talk to them, I will explain to them. If they are not really into it, I will just explain to them what I think as a Buddhist is important. And I will ask them to also tell me if they have any religious teacher that they have, maybe they may want to call, because this is the best opportunity for them to talk to the monk or whatever, you know, to learn more about Buddhism and also to help the patient. Yeah? No, I mean, that's not exactly my role as a doctor, but I can facilitate a little bit. Yeah.
Any more questions? Okay, maybe I have one more question. Dr. Kenneth, since you have seen maybe people in the hospital are going through a lot of suffering as well, going through death and all that, maybe do you have any advice for us as a Buddhist, so that we can live life fully while we are still living?
Actually, there's only one simple advice that's been there all along in Buddhism, is that you have to actually contemplate death. Yeah, that's actually the key. All right, and we should really get it out of our system that this is a negative thing to contemplate death. Yeah. In fact, if you are aware of death all the time, you'll probably lead your life very well. Ironic, right? Yeah, it's when we say, oh, pantang, cannot talk, cannot this, I tell you, causes more mess. Best is to be aware of it, deal with it, talk to your family about it, prepare them for it, you know, right? And even plan it all the way to the end, right? Because you know the end can come anytime, so, right? Don't say that when I'm old, then plan, right? Like, for example, for me, very simple. I always tell my friends, I say, okay, if I ever drop dead, right, I was found unconscious, don't bother to resuscitate. It doesn't matter, all right? Because chances are I'm going to be a vegetable, so not much point. Okay, that's number one. Number two, just dispose of the body in the most convenient and cheapest way. Right? I say I'm fine in a cardboard box and thrown into the dustbin, but of course it's not allowed. Yeah, so you just go and cremate, make it clean, and after that the ashes thrown in the longkang is fine. You know, right? Don't need anything, all right? Because it's not important anyway. It doesn't matter, right? You see, but sometimes, okay, not to make fun of people that want it, because I think sometimes it's actually part of the grieving process for the family, right? To have something to, you know, like, okay, got ashes, put in the niche, you know, I can pay respect, I can think and remember the person. So it's helped them to cope with loss, right? All these things that people do in memory of people who passed away is to cope with loss. That's all, right? Yeah, I mean, deep inside, we all know, right? The person is not there. You imagine that they're in a better place, right? But why is it so? It's because we have this long yearning that it is our so and so, therefore we have parted, we hope that they wish them well, and then we also have this little bit of, you know, attachment still. It's my so and so. But everybody is your so-and-so at some point in your life, somewhere in the whole universe. Right? Somebody is your so-and-so. So, I mean, okay lah, I mean, I'm not trivializing it, but the point is that, you know what I'm trying to say, right? So, but for yourself, you can decide. So you sort it out yourself. Just be clear, right? Yeah, I mean, no point for me to tell my parents this, right? So I tell my friends lah, because they're going to deal with the aftermath right? So I tell them, don't waste money, don't go and do these sort of stupid things, right? The money can be put to better use. I always joke about it, especially like sometimes, okay, I mean, this is not very nice, but patients sometimes spend millions of dollars for a futile thing, okay? For a really futile treatment, right? Would I want to spend $1 million for a futile treatment? No. I'd rather take that money and go and feed 10 families. What for? You're going to die anyway. Why go and waste that kind of money, right? And then after $1 million, you're still like that. What's the point? You see? Actually, strangely, a lot of medical people are actually not very in favor of all this prolonged and very complicated, long-drawn, poor outcome type of treatment. Yeah, a lot of us say, don't resuscitate. A lot of us say, yeah, just stop, don't do that. I don't want also. Strange, right? The lay people outside medicals want more. The medicals say, I don't want anymore because I've seen too much already, Yeah. Then they say, oh, we want to live a long life. They say, yeah, up to a point. I don't want to have a long life, but in a bad state. No, thank you, right? I'd rather have a shorter life, but good condition. Yeah. Anything else that you'd like to?
Yep. Anything else? One more question, last one.
Anything. The only reason why I spoke a little bit about mindfulness today is that because it's becoming such a hot topic, and I see everybody wants to teach mindfulness. Yeah, and all sorts of forms of it has appeared, which worries me a little bit. And then studies are starting to appear that maybe this is not so good, maybe not so good. It's because they're not being taught properly. That's the problem. Nothing, eh? How come there are so few questions?
All right. Okay, so thank you so much, Dr. Kenneth, for
Welcome.
very insightful and very inspiring sharing. Shall we all say 3 sadhu? Sadhu, sadhu, sadhu. Thank you so much.
Welcome. What's next?
We'll do the dedication of merits.
Okay.
All right. Let us invite all sentient beings to participate in our acquired merits. Etawata ja'amhehi sampatang punya sampadang Sabbe dewa anumodantu sabba sampati siddhya etawata ja'amhehi sambatang punya sampadang sabbe bhuta anumodantu sabba sampati siddhya etawata ja'amhehi sambatang punya sampadang sabbe satta anumodantu sabba sampati siddhya. Let us dedicate the merits of participating in a wholesome Dhamma activity to our departed relatives and friends. Idang me nyatinang hotu sukita hontu nyatayo. Idang me nyatinang hotu sukita hontu nyatayo. Idang me nyatinang hotu sukita hontu nyatayo. End of service dedication. I dedicate the merits which I have accumulated to the cultivation of my mind in order to bring happiness and benefits to all sentient beings.
I dedicate the marriage to my parents, children, spouse, relatives, friends, colleagues, and my adversaries, wishing them long life, good health, happiness, and prosperity. May we never part from the triple gem, and may we always walk the path towards enlightenment. Let us pay respect to the triple gem. Arahang Sama Sambuddho Bhagawa Buddhang Bhagawantang Abhivademi. Swakato Bhagavata Dhammo Dhammang Namasami. Supatipanno Bhagavato Sāvaka Sangho Sanghang Namami. Sadhu, sadhu, sadhu.
Okay, thank you so much everyone for coming today. So may whatever we have learned today can be an inspiration for us to live life fully and also continue to practice the Dharma. All right, we'll see you again next week on Sunday service at 10:30. Thank you. Thank you so much, Dr. Kenneth.